Welcome to RGV On the Rise, a limited series podcast about the economy and opportunities of Hidalgo County, the Rio Grande Valley, and South Texas. Please say hello to today's guest.
Welcome to a special edition of RGV On the Rise. A major measles outbreak in West Texas is becoming a growing concern and raises questions about what exactly the measles is. To help us understand this disease is Hidalgo County Health Authority, Dr. Ivan Melendez. Thank you so much for joining us. I guess the first question is, should South Texas residents be worried about this outbreak?
Absolutely. I think everyone is aware of the recent and third measles outbreak of this year compared to 13 all of last year. And everyone should be concerned of the numbers that we're seeing in West Texas that are half of what was seen the entire year last year. So this is definitely a health concern, and everyone in the world, in the United States, in Texas, and especially in South Texas, be extremely concerned about this outbreak. By the way, defined by 3 or more cases.
So let's step back a bit and find out, first of all, can you tell us what the measles are?
Oh, absolutely. The measles is a very interesting virus that before 1957, 90% of people were exposed to it. So if you were born before 1957, you already have some autoimmunity. This is a disease that is caused by a DNA virus. It's a very, if not the most infectious virus among the most. For example, influenza, you may infect 2 people. HIV, you may infect as many contacts you have. And of course, COVID, we were going with 1 to 3. Measles, on the other hand, you're going to infect at least 12 people, 12 to 18 people. Extremely contagious virus that is spread by usual air, which is throat, or by coughing. But it is such a sneaky virus that it can last up to 2 hours in the air. So someone can touch their phone, someone can have a cup of coffee, someone can sneeze, be gone for 2 hours. A person walks in the room, and it has a 90% infectious rate. So a person that has the measles active is likely to infect 90% of the people that he comes in contact with. So by far, the top 3 most infectious viruses known to mankind. It is deadly. 1% of people can die from this, mostly occurring in children. Most deaths, of course, occur in children, but all ages are at risk. And in fact, before the vaccine originated in 1963, we would have millions of cases a year in the world, which decreased in 1 year to thousands of cases in 1 year because of the vaccine. It is estimated right now by the World Health Organization that at least 60 million lives have been saved just since the year 2000 from measles directly attributed to the vaccine. So this very uncurable, highly infectious, deadly, or potential lifelong sequela disease is definitely of great concern and ubiquitous, and unfortunately, Carlos, thought to have become eliminated in about the year 1990 in the United States, well, very similar to smallpox. And unfortunately, we now understand that at least in the United States, and even more so in the world, this virus is far from being eliminated.
So what are some of the symptoms of measles?
Absolutely. I like to think of it as a 4-4-4. When you get infected by someone, it usually can take anywhere between 10 to 12 days, 14 days before you start seeing symptoms. Some people sooner, but the rule of thumb is about a week and a half. And 4-4-4 is an easy way to think about 4 days of a prodrome. That is before you know that you really have measles. Runny nose, congestion, fever, red eyes, muscle aches, myalgias, unexplained fatigue, lassitude, high fevers, 103, 104, 105. After day 4, we start seeing the exanthem. It's called the exanthem face, the rash face. At first, difficult to distinguish between fifth disease, Kawasaki disease, parvo, rubella, smallpox, chickenpox. It's a rash. It usually initiates in the back of the ear, along the hairline, and it tends to move downward. Neck, body, the entire body, palms are all affected. This is a flat, not necessarily itchy, red rash that is very bothersome and begins to disappear in the same pattern that it began to appear, from the feet down, opposite to when it started, from the head down. After that 8th day, we're moving into day number 9, 10, 11, 12. We start seeing recovery. The first thing we see, and by the way, most people recover. We start seeing the rash going away. The fever has subsided. The weakness is going away. And so we usually see about a 2-week window. Interestingly, there is a statute in the Texas code that says that if you're an unvaccinated person attending a school, that you have to stay 21 days out. So we know that if someone is unvaccinated, the requirement is, and you've been exposed in that school or somewhere to that virus, that you stay out for 3 weeks. But this, as stated, is a common presentation at the initial phase: coughing, congestion, cough, runny nose, weakness, fevers, moves on into the rash phase, as we described, and then 4 days of getting better.
So if you begin to see some of these symptoms, what would you advise?
Oh, absolutely, especially now. If you're a parent and you have not vaccinated your children, you should be concerned. And if you start seeing these, you should first ask yourself, is my child vaccinated against the measles? And if they are, if they've gotten one vaccination, usually around age 1, and the second one right before school, 4 to 5, depending what country you live in, then you go from you go from being infected 90% of the time without a vaccination with a mere casual contact to 93% protected and 97% protected with that second vaccine. So if your child is vaccinated, I think you can take a deep breath. That being said, 3% of people that are vaccinated for various reasons do not develop antibodies. As we discussed when we were talking about COVID, Carlos said, even 3% of the population is not going to respond. So even if your child is vaccinated, but you see the sequence we just mentioned: known exposure, 4 days of feeling lousy, weak, beat up, followed by this rash that begins behind the ear, itchy, the concern should be increasing. What should you do? You should immediately contact the health department, and of course, as always, your primary care provider. You should let your doctor know that you're having these symptoms so that he can have an isolation area for you, so you just don't show up to the office and infect 90% of the people that you see. And what your doctor will do is they will order a blood test that will measure your antibodies. And you have 2 types, ones that are made long-term and ones that are made acutely. So if you have what we call IgM, immunoglobulin M, then we know that it's a very recent infection. And that's how the diagnosis is made, by looking at titers, the counts of viruses that are, or antibodies, pardon me, that are in your bloodstream. Once the diagnosis is made, of course, the recommendations are going to be, as always with viruses, supportive care. Tylenol, anti-fever medication, hydration, and of course, isolation. Some literature indicates that even vitamin A given in 2 dosages is helpful to protect the complications of losing your eyesight or developing encephalitis. People will usually die from pneumonias or from meningitis, from encephalitis from this particular virus. So, although most
Dr. Melendez, you mentioned vaccines, particularly as it relates to children. Is there a minimum age by which a child can get this vaccine?
It's an excellent question. So you ask yourself, at what age is a human being, a Homo sapien, able to generate its own antibodies? And usually it's around 6 months. Before 6 months, you're still dependent on those immunoglobulins, those antibodies that you obtain from your mom through, of course, your umbilical cord, through the placenta. But at about 6 months, you start seeing the onset of various vaccinations. The recommendation, of course, is 1 year or close to 1 year in our country. But yes, in areas where there are epidemics, we, of course, even reach out to even the 6 months old and above.
And how is Hidalgo County preparing for this latest outbreak?
Well, that's an excellent question. And we are under a preparation phase that incorporates, I would say, thousands of people if you also look at the other stakeholders that we're working with. It's first important to say that the most important thing that you can do in a disease that has no cure is to prevent it. And so, as usual, prevention depends on acquired antibodies. And that, of course, depends on vaccinations of this disease more than any other disease that I can think of. That, in fact, some communities you measure the efficacy by vaccinations just by looking at how many measles. So when you see children dying of measles, you know that that community has an ineffective vaccination status. And so what we're doing specifically to be aware of this potential lethal condition is education, 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 vaccination. 99% of seventh graders in Hidalgo County have been vaccinated. 95 to 97% of all children in school in Hidalgo County have been vaccinated. And so when we talk about educating people about vaccinations, very important. And of course, when you have a 99% and a 97%, we're one of the best counties when it comes to being vaccinated. When you look at where the current problem is in Gaines, the 3 school districts, one of the schools only had 46% of their kids to be vaccinated. It's easy to understand what a different situation they're in than a county that has 99% and 97% vaccination. And so what we're doing is educating about the importance of all vaccinations, specifically measles, educating our school districts, our jails, all those areas, our hospitals, our doctors, where we have a higher awareness of measles and the potential outbreak of it. And another very important thing we're doing is we're identifying through epidemiological studies and contact studies are 2 cases that were suspected. Why were they even suspected? Well, because we knew that they were at a museum in San Antonio where there was a potential exposure. Fortunately, both those cases have been negative, but they had rashes, although not very typical to measles, but still needed to be tested. So contact tracing, communication with the other communities, the other healthcare communities, other departments, a guidance from the CDC and from the state health departments, education, awareness, preparedness, and like we're doing today, getting an awareness in our community.
You mentioned earlier the lessons of herd immunity that we learned during COVID. What other lessons did we learn during COVID that can be applied here today?
The most important lesson that I've ever learned in medicine occurred during COVID, and I think it's applicable to what's going on today, and that is access to adequate health care. Why did so many people in COVID die from hypertension, obesity, diabetes, and advanced age in Hidalgo County, more so than neighboring communities? Willacy, Cameron, Laredo, those areas that are also border towns. And that's because our access to healthcare was much less. And so we know that when your other comorbidities, when your vaccination rates, when your nutritional status, when your access to appropriate medication, when you decrease smoking, when you're aware of alcoholism, all those things that access to healthcare provides, communities do significantly better. And so we want to apply what we learned during the COVID pandemic, access to healthcare, in a population with number 1, diabetes, hypertension, and obesity, least access to healthcare. 9% in the country of the people do not have adequate access to healthcare. In Texas, 19%. In the Rio Grande Valley, 40%. So when you multiply, and I hate to use a cliche, the perfect storm, it becomes a perfect storm. So we definitely want to give people access to education, vaccination, and basic health care.
Now we're approaching spring, and there's a lot of significant events that are happening during the spring. One is rodeos. There's great concern about the Houston rodeo, which draws a lot of people from West Texas where this outbreak is occurring. But another is spring break, which draws a lot of people to South Texas. What should we do relative to the expectation that spring break is right around the corner?
I think we need to look at it 2 ways. Number one, is it a moment where we need to increase our awareness and increase our interventions? Absolutely. The usual activity associated during spring break is promiscuity, close proximity, engagement of libations in public. And so easily transmitted during those events that we see, those concerts, those dances, those raves that we see during spring break. And of course, where are our outside citizens coming from? They're coming from areas that are potentially either directly in West Texas or other areas. Let's remember that there are outbreaks right now in California, Alaska, New Jersey, Georgia. So not only West Texas, but specifically for us, West Texas, people will come down, and I am sure that someone will be carrying this particular virus. Fortunately, those people that are at greatest at risk, the small children and people our age, I don't think I'm going to see you at spring break this year, Carlos. But those people that do go there are healthy people. And so I don't want to raise the idea that they're safe, because they're not, because they come in contact with little children and grandparents. But it's certainly a time where we need to remind them about the appropriateness of behavior. And above all, if you have symptoms, don't come. If you develop the symptoms, leave, go to your hotel room, isolate. And so early identification, early diagnosis, and I think, Carlos, this is so important. What is our individual freedoms versus the collective good of our community? So if we raise an awareness that we all are for not telling people what to do, and we all are for doing what you want, let's not forget that sometimes doing what you want implicates others. And so that's really important.
Let's delve into that a little bit more, because one of the other lessons of COVID is the notion that a certain percentage of our population is anti-vaccination. Can you tell us a little bit about the MMR vaccine, where it came from, what it does, and how efficient it is?
I think that's an excellent point. Let's first start off by saying this. There's nothing in the world and in medicine that is 100% safe for everybody or 100% effective. So if you give out 6 billion vaccinations like we did and have been for COVID, or you eat 6 billion hot dogs, something bad's going to happen. Or you cross the street 6 billion times, or you drive 6 billion miles, something is going to happen. But what we want to weigh is the benefit and risk versus the vaccination or the disease. So this vaccine now, only in the last 25 years, has been accredited to saving 60 million lives in the world, 60 million lives. Not to mention the long-term effect of these diseases if you don't die. It lasts your entire life. You do not have to be rebooted when you're 80 years old.
Let me push back on that, because there are some media reports that are suggesting that that early version of the vaccine, those who were vaccinated before 1968, may have some problems and may need a booster. Can you?
Oh, absolutely. That's a great point. I think it's a very technical point. It's probably a point that's not of much help to our listeners. After all, there were only 600,000 of those vaccines that were administered during those years. So it was a minimal amount. It wasn't the total amount. It was that particular vaccine. And let's remember, if you were born before 1957, quite frankly, you're supposed to have natural immunity. But those people that got it in the 60s, before 68, the question is, was this vaccine effective in producing enough antibodies? And now that you're 80 years old, well, I guess back then, that population, my population, we would be in our 60s. And so do we need to reboot? And you can do it two ways. The technical way is to go to your doctor or go to a doctor and get your blood tested. And you will actually be able to get a load or a count of how much IgG, or the immunoglobulin that's there for a long time. What is your titer? How much do you have in your body? Similar to what we do with HIV testing. Is it active? Is it not active? How much is it active? What are your counts? Similar to that. And so you can do it that way if you want to be mathematically correct. And if you have a threshold number, you don't need to do it. The other way to do it is just to get your vaccine, get another vaccine. It's not going to hurt you. The problem with getting a vaccine when you don't need it, one is the minuscule risk factors associated to vaccines, this particular vaccine. And number two is that it won't work. So if you have immunity against something you're being vaccinated, then that would mean that your immune system would destroy the vaccine before it worked.
Okay.
Not that it's going to hurt yourself.
Dr. Melendez, is there anything else that you would recommend that the steps we take in order to prevent infection?
I think the most important things that people can do is keep their eyes open, keep their minds open, look to see where their information is coming from. What are the vested interests? It hurts me to say that a lot of people have lost trust in the medical profession and government and scientists and doctors. It hurts me. And I believe that it's not because we stopped doing 18-hour days. It's because of the ill information that's aware in all sorts of media outlets. And Perhaps we erred a little bit also, in the sense that nothing is safe 100%. So I'd like people who are not vaccinated, that's who I'm reaching out to, because those that are vaccinated, quite frankly, have little to worry about. But those that are not vaccinated, I would like for you to weigh out the following and ask yourself truly, what are your risk factors if you get a vaccine versus the risk factors if you get the disease? What are your risk factors, as I said before, Carlos, if you fight Canelo Alvarez, the disease, or Dr. Melendez? You much rather fight Dr. Melendez, the vaccine, than Canelo Alvarez. So don't hesitate. The balance is obvious.
I would never want to fight you, Dr. Melendez.
Canelo Alvarez would, I guarantee you.
Hidalgo County Health Authority, Dr. Ivan Melendez, thank you so much for your time and your insights.
Thank you, Carlos. My pleasure.
In our next episode, we speak with the health department about the upcoming South Texas All Hazards Conference. They tell us what we can expect at the state's second largest conference for first responders. Join us on March 19th for episode 4 of season 2 of RGV on the Rise.